It's official. Former director of the Department of Administration, Benita Manglona, is now the chief financial officer of the Guam Memorial Hospital. Manglona has been instrumental in helping Guam get its finances in order, and now that she is at GMH, she's already begun tackling their flatlining finances.
In fact, the first thing I did on Monday when I came in was appointed a business manager for the business office that handles the patient affairs registration, the billing. They have been without a leader since last year. I think maybe about 8 months.
Although she has been on board officially for 1 week, Manglona first assumed the role of acting CFO several months ago, when then CFO Alan Ulrich resigned. Since then, she's been able to assess GMH's financial deficiencies.
One of it is we've been having problems with the billing. We had a system conversion, if you'll recall, back in October, and we have had a lot of bumps along the way. But we were able to bring back the consultant and did some more training, and as a result of that, we are beginning to send out billings because we really haven't been sending out the billings.
Manglona says GMH has been sending out bills, however admits that there has been problems with the billing process, which has resulted in a long process for sending out the bills. She adds she has written to insurance companies in hopes they will work with GMH and give them the opportunity to submit billings despite exceeding the 90-day submission deadline.
We have a new system that we converted to, and a lot of it is educating the staff on the new system, and we had just done that just recently, and we just need to improve the processes, how we do it. A lot of it is I mean, there's also the fee schedule that is so outdated. It's been since the 90s, and it was also pointed out in the OIG report, and we recently had a consultant come in back in November, and they were here for a couple of weeks, and they reviewed our charges.
In fact, Manglona says they have identified that there are some charges that GMH is not capturing, and notes that the fees that are shown in the fee schedule must be fixed.
Well, it's inevitable. That is one of the deficiencies that was reported in the Office of Inspector General report that came out last year, and one of it is the fee schedule, that GMH's fees is outdated and it needs to be raised. So that's one that I will be looking at.
She says GMH will aggressively pursue the new fee schedule submitted to the legislature so that it can go through the AAA process, in addition to actively training their staff on the billing process so that it translates into cash. Manglona says that GMH will also be exploring federal grants, which may assist in overcoming the financial challenges that have plagued the hospital for decades. Reporting for Guam's News Network, I'm Jolene Toves.